Thank you so much for choosing us. Now, 266 containers fully loaded with antiretroviral drugs, insecticide treatment, rapid diagnostic tests, that is RDT, cartridges and others remain exposed to the weather at the Tema Port for over a year, as government expects donors to cover the $3.6 million clearance cost. Civil society organizations in HIV, TB, and malaria say the delay in clearing the much-needed health commodities is adversely affecting healthcare delivery in the country. We'll speak to the Executive Director for Hope for Future Generations shortly, but let's move on to what Parliament has been saying about this particular issue, where Parliament Health Committee is asking government to, as a matter of urgency, release funds to clear locked up health essentials at the port. Hotoji Alexander Roosevelt is MP for Central Tongu and a member of the Health Committee in Parliament. He spoke earlier on News Desk.
So I think there is the need for us to protect the image of this country. There is the need for us as Parliament to make sure that we liaise with the presidency through our chairman and all the revenue collection agencies for them to ensure that we clear these goods so that we will remain in the good books of Global Fund. Other than that, Ghana's image will be dragged into the mud. But that's notwithstanding, let me say here that the $40 million that we are talking about, the $40 million that we are talking about, that is just for logistics. There are other things that we benefit from the Global Fund, because in total, we always get not less than $100 million from Global Fund. So if we are joking with the logistics now, the situation will be that we'll be losing that. And Ghana is not better positioned to take its own destiny into its own hand. That is my fear. The relationship with Global Fund now will be something else. What I know is that because the procurement was made by the Global Fund itself, people are not happy with it. And I believe that is the cause of this food dragging situation in the country. But we must live beyond our personal interest. We must live beyond our parochial interest and take the country's interest to heart. I strongly believe, because we experienced this with the Gavi and this one with Global Fund, this is in itself a vote of no confidence in the current leadership. Because to restore the relationship with Global Fund now, there should be a new leadership altogether. There should be a new leadership altogether.
Now, joining us on this issue is Cecilia Lodono. She is the Executive Director for Hope for Future Generations and also a board member of the Global Fund. We are grateful for your time, Madam. Share with us when this decision was taken and why.
Thank you.
Yeah, so I was asking, share with us at what point was this decision taken and what's the key reason behind this particular decision to suspend supplies to Ghana?
Okay, thank you very much. Good afternoon, and good afternoon to your listeners. I would like to say that Global Fund will never suspend commodities to Ghana, because the persons affected by TB, HIV, and malaria are at the center of the Global Fund program implementation. And this decision to suspend might not be suspend, but it's likely that because the country is unable to clear very large quantity of commodities, the containers are still packed at the port, the space to bring new commodities is not possible because they will have to deliver more. And so what is happening now is that Global Fund is just waiting to see if this will be cleared so that they can have enough space to send more, because these are drugs, life-saving drugs for persons who are infected by HIV and TB and malaria. And so that is what they are working around. So as soon as it's cleared and there is space, I think there will be, they will continue sending more, because it's the country that requests for quantity of commodities based on our disease burden. And so it's a country that is asking Global Fund for this. And our responsibility is to ensure that we clear it from the ports.
All right. So because yesterday the CSOs told the media that there's some suspension of some of the medical supplies that were supposed to come to this country. But going forward, what is the fund's position, even if this consignment is cleared? I mean, or maybe it's not cleared. What is your position?
Well, you know, the way Global Fund works is government-to-government partnership, but for Global Fund, communities and civil society are very important because of accountability issues. And so what will happen is that the country has to sit down and see how they can grant a kind of immunity to Global Fund. And so whatever is blocking this, the country has to agree. And I know these are diplomatic system and structures that every country working with Global Fund is supposed to adhere to. Unfortunately, as a country, we are not able to do that. I know there has been a lot of discussion and advocacy at different levels and a lot of promises. And so what I would suggest, as a Ghanaian, as a civil society person and an advocate for the three diseases, is that we should immediately put systems in place. I think what is good is that we have a partner that is willing to support the country. Just imagine all this number of persons living with HIV. If we don't get them this drug, and it's life-saving drugs, you know, so that will mean that they'll die. And I wonder if the country has that money. Global Fund doesn't only procure, they also support our health systems. And it was all this investment that has made the country stronger, and we're able to fight diseases, and we continue to fight diseases. And so I think we should prioritize partners who work with us, and also plan to own our own health instead of depending on donors. And that is why we are calling for more domestic resources to ensure that we own health and make sure that we invest money in health, build stronger health systems so that when you are sick, you don't need to travel to any country. If African countries are doing it, why can't we do it as a country? We should all have a stronger health system, address the gaps and governance structures that we have gaps in, and make sure that we call spade a spade and move forward as a country. It's embarrassing at times when you are at the global level and they are talking about Ghana, you know?
All right. Thank you so much, Madam Cecilia Lodono, for sharing those details with us. We'll still keep our eyes on this particular story. But